Tick-borne encephalitis, TBE, was first identified as a distinct clinical entity in the late 1930s in the far eastern part of Russia. The disease was recognized in the region of the Ussuri River, with the first clinical descriptions being made in 1937. This discovery was a significant development in understanding tick-borne diseases and their impact on human health. Tick-borne encephalitis, TBE, infection typically follows a specific route, beginning with a tick bite and potentially progressing to serious neurological complications. The process starts when an individual is bitten by an infected tick, usually of the Ixodes species. These ticks are often found in forested areas, grasslands, and occasionally in urban parks. Once the tick has bitten a person, the TBE virus is transmitted from the tick's saliva into the individual's bloodstream. This leads to a brief period of viremia, where the virus circulates in the blood and spreads throughout the body. The initial phase of the illness usually manifests with flu-like symptoms, including fever, headache, fatigue, muscle pain, and sometimes gastrointestinal issues. This phase generally lasts for about 2 to 4 days. After the initial symptoms, there is often a symptom-free period that may last about a week. However, in some cases, the virus then progresses to a second phase that affects the central nervous system. This can result in various neurological symptoms, such as meningitis, encephalitis, or meningoencephalitis, which is a combination of both. These conditions involve inflammation of the membranes around the brain and spinal cord or inflammation of the brain itself. While many individuals fully recover from TBE, some cases can lead to severe and long-term neurological complications or even be fatal. It is also important to note that though rare, TBE can be contracted through consuming unpasteurized dairy products from infected animals. However, the primary mode of transmission remains through tick bites. Vaccination against TBE is available in some countries and is recommended for people in or traveling to areas with a high prevalence of the disease. Tick-borne encephalitis, TBE, typically manifests its symptoms in 2 distinct stages, often starting with signs resembling the flu. Initially, after an incubation period of about a week or 2 following a tick bite, individuals may experience flu-like symptoms. These symptoms include fever, headaches, fatigue, muscle and body aches, nausea, and sometimes vomiting. There may also be respiratory symptoms like coughing or a runny nose. This initial phase usually lasts around 2 to 4 days and can easily be mistaken for other viral illnesses. Following this, there is often a symptom-free period lasting about a week. However, in approximately 20–30% of infected individuals, the virus progresses to a more severe second phase impacting the central nervous system. This phase is marked by a high fever and severe headache. Symptoms of meningitis, such as neck stiffness, may become apparent. Individuals might also experience mental disturbances, including confusion, drowsiness, and sensory disruptions. In more severe cases, symptoms can escalate to encephalitis, characterized by seizures, paralysis, and movement disorders. Rarely, the spinal cord might also be involved, leading to myelitis. It's noteworthy that not everyone infected with the TBE virus will develop noticeable symptoms. Some may remain asymptomatic. For those who do enter the neurological phase, the severity can vary significantly. While many recover fully, some people may suffer from lingering neurological effects like memory problems, concentration difficulties, or persistent headaches. In severe instances, TBE can lead to fatal outcomes. Given these risks, preventive measures such as vaccination, avoiding tick-infested areas, using insect repellents, and wearing protective clothing are crucial, especially in regions where TBE is more common. Treating tick-borne encephalitis, TBE, primarily involves supportive care, as there is no specific antiviral treatment available for this viral infection. The treatment strategy focuses on alleviating symptoms and supporting the patient's body in fighting off the infection. Supportive care is the foundation of TBE treatment. This includes ensuring patients get sufficient bed rest, particularly during the acute phase of the illness. Hydration is crucial, which can be maintained either orally or through intravenous fluids, depending on the patient's condition. To alleviate headaches, muscle pains, and fever, Pain relievers and fever-reducing medications such as acetaminophen or ibuprofen are commonly used. If nausea and vomiting are present, antiemetic medications might be administered. In severe cases, especially those exhibiting neurological symptoms like meningitis or encephalitis, hospitalization is often required. Hospital care allows for close monitoring and management of any complications that arise. Patients may receive intravenous fluids and medications, and in more severe cases, oxygen therapy and respiratory support might be necessary. When TBE affects the nervous system, specialized neurological care becomes essential. This may involve the use of medications to control seizures, interventions to manage increased intracranial pressure, and, following the acute phase, rehabilitation services. Physical therapy, occupational therapy, and speech therapy can be critical for patients with motor deficits or cognitive impairments resulting from the infection. Apart from treating the illness, emphasis is also placed on prevention, given the lack of a specific cure. Vaccination is a key preventive measure in regions where TBE is common. Other preventative strategies include using insect repellents, wearing protective clothing in tick-infested areas, and avoiding the consumption of unpasteurized milk and dairy products in TBE endemic regions. Prompt medical attention is crucial for individuals who suspect they might have contracted TBE or who have been in areas where the disease is prevalent. Early recognition and supportive treatment can help manage symptoms effectively and reduce the risk of severe complications.